Well, I'm here for my final appointment at Gold Coast Dental Solutions. Hopefully I'll get my tooth today and then the whole process will be finished. So all the work and the actual implants all healed up perfect, and we'll go there today and get the tooth, and hopefully it'll make the smile a little bit better. What do you think, Cara?
Yes.
That gives us a nice 3D model of your teeth.
Yeah.
In the lab, and then design the tooth for me. I get to check that before it gets made. So if you look close here,
You send all them.
Yeah, that's good.
Measurements and everything.
Yeah. And that little thing is what's called the abutment. That's the part that connects to the implant.
Oh, yeah.
That pink is your gum, which we can subtract now. That's the implant sitting under the surface. That's the abutment, which is like the gold titanium part. But then there's a screw head down there. That part screws inside the implant, and the crown bit goes on top like that. So you can't see the screw hole then. So internally, there's a screw inside there, but that's hidden.
The tooth just covers it all up.
That's right. Yeah,
Yeah.
for sure. Yeah. So it's pretty straightforward today.
Yeah. So today, you just take the cap off and mount the tooth.
For sure. Yeah. I'll do a bit of local because that cap is a different shape to the tooth, so it's got a bit of flare to it now.
Yeah.
So you can see that's the implant head down here. And this thing flares out to the best proportion for the tooth.
Oh, yeah.
It's a bit more flare that way than the cap.
Yep, I know what you mean.
So a bit of local to some sort of pinch and be tender, but it's pretty straightforward. That's the implant down there again. That's the implant. That's the screw inside the implant. That's the hex of the implant. You can see here.
Oh, yeah.
And the abutment's got a male hex that then clicks down inside that. Yeah, it's pretty cool.
Yeah, pretty amazing.
I know. And I get to check that, and I can tweak it once I say yes, I like that. Then it gets milled to that exact spec. Yeah. So there's no surprise. Back in the old days, we send it off with a physical model.
Yeah.
And I'd write down instructions. I get it back, and most times it'd be right. Sometimes you get it back and go, "That's what I wanted."
You can just tell.
Just send it back and get it back and forth. Whereas now, there's never any redos because it's what I want.
It's spot on.
Time,
Yeah, it makes all the difference, doesn't it? Than having to go backwards and forwards several times.
It's just sold.
That's pretty amazing, isn't it?
Pretty cool, eh? That's the same spot that your old tooth was before you broke it, remember?
So this new one will be sort of in the middle.
Yeah, it is, yeah. You can always put something there later on if you want to, but we're trying to keep things sort of in budget for you as well.
Yeah, exactly.
I think one tooth's going to replace you back to your former glory where you were beforehand.
Yeah.
So yeah, right there was the tooth before it broke, and it's in the same location as where it was back then. See, there's a little gap here, gap there, and it's the same.
Yeah.
It's the same as that, so I sort of copied what you had prior.
Yeah.
Remember the one behind it, the sinus is a bit lower, so there's less bone here before one implant. And the gap was kind of skinny there for a second one, so it's sort of in the best location.
Yeah.
Cool. Reckon pretty cool. You lost interest.
We get it done, Cara.
I'll go and grab it for you. Actually, it might be here. Yeah. So look at that shape there, and that's the exact shape. Yeah, so that's the abutment, that titanium part.
Oh yeah.
Screw inside that, and then the crown glues over the top, so you can't see it. Then
so it actually glues
it does.
on.
Yeah, for sure. Yep.
Yeah, because you wouldn't want it coming off.
No, and that way all the hardware you see there is hidden. You can't see it.
We were wondering whether you could take it off or not, weren't we?
No, not at all.
Once it's on there, it's on there.
There's even some pretend gum there that looks sort of blended.
Oh yeah, because I was wondering about that.
Yeah,
Like
you've got quite a big vertical defect there. You can see your gum here, and it dives right down.
Yeah.
So we put some pink gum to make it look more like a real thing.
Yeah.
And it's got your name cut in the side from the
so that's
from the printing. Yeah.
That's the actual tooth and everything.
Yeah,
it comes back on the mould
from that spec. Yeah.
Would that be done on a 3D?
It's printed. Yeah.
It's
printed. Yeah, that's printed. That gets milled.
Yeah.
And they fit that back on the mold when it's finished.
So once the 3D printer just copies it exactly the same.
Scan. Yeah, totally. Yeah. Yeah, it's pretty clever, eh?
We were looking at making things yesterday on the computer, weren't we? Similar thing.
It's cool, eh? All right, mate, let's do it.
Yeah, all right.
That little torque wrench we use. That just puts the correct tension on the screw, joins the abutment, that gold bit, to the implant. It's like a little spanner. You've probably seen torque wrenches before, Gary, I'm sure, on a grander scale. Sweet. Yeah, grab a bit of sugar of that. That's the abutment. And the crown is going to slide over the top very soon to glue on. Like so. Voila. Cool. Thanks, Gary. Lovely. Let's get some tape.
Got the new tooth, and it feels a little bit strange because there's been a gap there for a fair while now. Now I've got the new tooth, but Michael did a fantastic job. It looks perfect, it fitted perfect. So now, not so much of a gap, and it was just a great process from Gold Coast Dental Solutions. They did a fantastic job right from the start to the finish, and very happy with them. So thanks very much, Michael and the crew.